Welcome back to the Leading Boldly podcast. Today, we're joined by a leader who's changing the future of mental health care. Erin Lee is the CEO of Flow Neuroscience, a Swedish health tech company behind the first at-home alternative to antidepressants in over 35 years. Flow's wearable brain simulation device works alongside a digital treatment platform, offering a new way to manage depression. In a major clinical trial, the device outperformed 21 leading antidepressants, a breakthrough that's earned a feature in Nature's January issue, The Future of Medicine. Flow is already helping 35,000 people across the UK and the EU, supported by over 200 clinics and select NHS trusts, with a US launch coming later this year. But Erin's journey to Flow is just as bold, with nearly 2 decades of experience at the helm of some of the world's most dynamic tech organizations. She's led global operations at Babylon Health, helped scale Uber across Europe and the Middle East, and shaped innovation strategy at Google. Her gift lies not only in building high-performing teams, but in applying deep operational expertise to sectors ripe for disruption. Erin is a global thinker, a champion of bold ideas, and someone who brings fierce compassion to complex challenges, making her exactly the kind of leader we're thrilled to have here and to learn from. Erin, welcome to the Leading Boldly podcast.
Thanks very much for having me. I'm really excited to be here.
Awesome.
I'm very excited to have you here. I've been waiting for this for such a long time because I love what you do. I love it. And it's really funny because when I learned about Flow Neuroscience, literally every advert on TikTok that came up was for Flow. And I was like, right, must get Erin on. And we had a bit of a clash of dates and stuff. So it's great to have you here. I'm really excited.
Really excited to be here.
We always start at childhood on our program because childhood can really, really kind of show where you are today, or even be a complete change from where you are. So, what was childhood like for you?
That's a very interesting question. So I think I grew up in a very traditional, like American middle class family in a way that probably doesn't exist anymore. But I grew up in the Bay Area. So actually I'm originally from Mountain View, California. So sort of the home of Silicon Valley, although when you're a child, you sort of take that for granted. I am an oldest daughter. I have 2 younger brothers. My father worked in high tech. My mother worked in high tech for a little while, and then moved on to sort of property management. Again, I would say fairly traditional. I think my parents were very strict, very tough. But I think a lot of what I got in my childhood has absolutely played through to adulthood in particular. So I was a competitive swimmer for almost 15 years, starting when I was 8 years old, and I hated every minute of it. I would get so nervous. I hated swim meets, but unfortunately or fortunately, I was very good. And so my parents were always like, you're not going to quit things. So you don't quit things that you're good at. You're going to thank us later. It's a good character builder. Like, you will swim. And so I went on and swam, like I said, for 15 years. And that sort of grittiness, I think, has really played through the rest of my career. So yeah.
And do you agree with them that you would thank them for that later in life?
Yeah, absolutely. I think my parents were always super supportive, but they really pushed us outside of our comfort zone. And I think that's what you find in life, right? They were always, tremendously supportive of exploring new ideas, whether that was religion. I went to school in Iowa, which was unheard of. I went to this really tiny liberal arts college called Grinnell, and everyone's like, what are you doing there? And I was very interested in politics, and it's very big with the Iowa caucuses, but they were very supportive, even if sometimes they're just like, okay, I enjoy the winter. And yeah, so I think I would thank them. Yes.
Where now?
Pardon?
Where are you based now?
So now I split my time between London and sort of the rest of the world. I say I'm in some ways a little bit homeless, but yeah, bounce between London. We have an office in Sweden. I spent some time in Portugal, and then back in the Bay Area.
Oh, awesome.
Amazing. And so persistence and high tech were definitely in your veins right from the get-go.
Yeah, I couldn't escape it. So I don't, I always thought I'd be a lawyer or something boring, but when you grow up in Silicon Valley and you get exposure to it, yeah, and it's kind of hard to beat.
I get the impression that you probably quite liked school. Is that right?
Yes, I did. I was very driven. I was very competitive. That's still true today. I was not one of those people whose parents had to force them to study or try and get good grades. In fact, a lot of times they were trying to tell me to relax. But yeah, I love learning. I love knowledge. And I love the challenge. So yeah.
So other than swimming, what did you do any other kind of activities? Was it all sports competition based?
It was all sports competition. I also played water polo for a number of years, sort of goes hand in hand with swimming. But in many ways, I liked water polo more. It was a team sport. And I find there's a lot of synergies between team sports, team athletics, and the business world, as you can imagine. And then when you're doing competitive sports, there isn't a lot of time for much else, including vacations or it's your weekends. It's all week. We practice like 5 hours a day. So yeah.
Yeah, my cousins all did competitive swimming and it was very tough. It's 5 a.m. You get up, you swim, you go to school, you go.
Exactly. We go swim again. Yeah. It's a lot of repetitive performance.
So tell us a little bit about the journey from those early days into, quite frankly, like tech mega companies.
Yeah, I think people look at my resume and they're like, this makes no sense. Like, how do you go, particularly now, they're like, how are you running a neuroscience company? And it's a fair question. When I started my career, I actually started in elections, believe it or not. I spent a couple of years running elections out of Austin, Texas. And then I moved back home and I got a job with Google. And I would say I was there for almost a decade, 8 years. Fantastic place to cut your teeth. It was still, again, it was post-IPO, but still relatively small for Google. You got exposure to so much. And there were really tremendously intelligent people. They're just wicked smart, like Claire Hughes Johnson, Sheryl Sandberg, who went on to Facebook. And you were just surrounded by this intensity and this intelligence that I absolutely took for granted as, a 22, 23-year-old. But it really gave me an excellent foundation. In school, I had studied overseas, just like your typical American. I studied at the University of Bristol. And there came a point where I really wanted to come back overseas and get some international exposure. That was also because I saw a lot of folks coming from Europe to the States and they thought about problems differently. And that was sort of the impetus behind my move to Uber. Came over here and I worked on Northern Europe and the Middle East. I loved Europe and I loved Uber. Again, incredibly intelligent, passionate people. We worked super hard. I think Uber for me will always be evidence of like what is possible if you get the right people in the room. Like we did the impossible every day. I know it doesn't always have the best reputation, but I would say it was a fantastic company. I had no intention of leaving. But one day I got a phone call from Ali Parsa over at Babylon who wanted to talk to me about healthcare. And I really didn't care that much at the time. But he just had this incredible vision for what was possible. And, my belief is, we have one life. Let's maximize it. Let's do what we can. And, at Uber, it started to be like, you're going to meetings, talk about the next meeting. Let's have a meeting to circle back. And it really felt like an opportunity to have real impact. And, for better or for worse, Babylon didn't work out in the end, but I learned a tremendous amount. In particular, what you see with healthcare is, it's really sick care. And I think Ali's vision was, can we engage earlier with patients and really give holistic care in a way that is delightful and looks more like a consumer experience, right? Which is so badly missing. So again, it didn't work out, but I think once you get into healthcare, it's very hard to justify doing anything else because the impact is so great. And at the end of my 4.5 years at Babylon post-IPO, I had outreach from Daniel and Eric, 2 Swedish guys who had created the headset. And I thought, this thing is crazy, but if it works, it could change the world. And I guess the rest is history.
Yeah, I totally agree with what you were saying about the social impact side. I know through the work we've done with the NHS and various mental health charities, that balance of sort of commercial success with the social impact can be really addictive.
Yeah, it is. And I think you get the real-time feedback from people whose lives have been changed. Even at Uber, it's just taxi rides, but it could be really transformational in certain environments, but it pales in comparison to healthcare. So
yeah, no, absolutely. I would, as a brand strategist, I would love to know. I would give quite a lot of money to be a fly on the wall in some of the early Google experiences and rooms that you were in, and Uber.
yeah.
Give us a couple of takeaways from Google and Uber that really shaped the way you think now, because you think differently to most.
I don't know.
Oh, I think you do. I think you must do to get the kind of results you're getting.
Yeah, I think you must. I think in the Valley, the one thing that's sort of pervasive is there's an embrace of risk, right? Which maybe is not so true in other industries. I think when you when you begin a startup, there's a huge chance of failure, right? Like over 90%, it's not going to make it. But on the flip side, there are these transformational ideas. And I think, some of the synergies, Google and Uber, similar, very different in many ways. But there was an obsessiveness about the experience. And that was everything from, I remember what was it, Marissa Mayer, the dots and the pixels on the Google logo. Most people would just say, it's primary colors, but which primary color? And you might not think it matters, but it's something that, hundreds of millions of people look at every day. And then the same was true at Uber. We obsessed about waiting times and matching and pickup points and experience, whether it was a rider or a driver or indeed eaters later on. And you could say, was that overkill for restaurant delivery? Is that overkill for search results? And my goal has really been, how can we take that extraordinary experience and that obsessiveness and bring it to a place where it really belongs, which is healthcare. And yeah, I think you have to take some risks, which as you get older become increasingly uncomfortable. But, what is the alternative?
What did you find in the difference when you came to the UK? Because if your main base is here, culturally, they're very different. What was the kind of biggest surprises for you?
I'd say the vacation schedules or the holiday schedules. I joke, I haven't really taken a vacation in 20 years. And it took me a little while to get used to that. And also to understand sort of the demure British way of giving feedback. Americans are very blunt. We're to the point. If we don't like it, get out. We hate it. That's not, that's fine. Or, it took me a little while. But in many ways, there's sort of there's a grittiness to the British as well. There's a humility, which you don't always have with Americans. We're very brash, bold. You'll hear us before you see us in many cases. And so I would say, it didn't take long and I admire a lot, but yeah, there's definitely a learning curve.
It's interesting because you are the second American female moved to the UK that we've done a podcast with in a row. So our last episode was with Jordan Cracknell, and an amazing woman. She is absolutely fabulous, and she's trying to get girls into the finance industry. So she works in finance in London. And you basically both said the same thing. She has this really kind of a sarcastic humor that lots of people are just like, what? Don't talk to me like that.
Yes, exactly. It doesn't always resonate.
Yeah. So you were really interested in politics early on, and I have a bit of a thing that I talk to people a lot about, and my personal philosophy and belief is that it's no longer politics that make all the meaningful positive changes in our world. It's actually business, and particularly innovative business. Do you agree? And do you think that there was a point where you realized that, even subconsciously, and so you've taken that route rather than politics?
Oh, absolutely. It wasn't even subconsciously. I definitely agree with you, which is in some ways sort of a shame. And I think a lot about, why in the States most of our politicians are 70 and above, when it should be, we should look a lot more like the Nordics, right? With younger politicians. But so like I said, I went to college, university in Iowa, Grinnell, very small university, liberal arts. But the Iowa caucuses are a massive part of the primary circuit in the US. And so it's a tiny state, but it gets a disproportionate amount of attention because it's early on in the primary election cycle. And so basically, as goes Iowa, so goes the rest of the US. So you get a lot of candidates. And, I had the pleasure or the opportunity to meet a ton of US politicians. And I think, with a few exceptions, in general, you meet them behind the scenes. And I think there was a point at which it didn't really seem that appealing anymore. Outside of their sound bites, they weren't always the greatest people. I think you also sort of start to dig, and it becomes, pretty evident that you can't really do anything. It's really the lobbyists. It's everyone outside of politics. And you talk to, some people who go into politics and want to make a change, and they tell you stay out of politics and just become a donor. You can have more impact that way. So it's disheartening to be sure, but it's probably the reality.
There's going to be a few assumptions throughout this, but I'm going to put my assumptions out there and then you can respond. Okay. So I'm assuming that you would really resonate with the phrase of you are the sum of the people that you surround yourself with.
Yeah.
And how important it is to surround yourself with amazing people.
Yes, I would agree with that. I think I've been known to say that my goal is to always be the dumbest person in any room by far. I have the privilege of working with many folks, for almost a decade now. They've been with me their whole careers. They know me flaws and all. I think what really works is, particularly in industries where there isn't necessarily a clear path. I think the acknowledgement, like no one has done it before. It's going to take a lot of wicked smart, hardworking people. We'll figure it out. And the humility that comes with it, and the teamwork, right? The trust. So yes.
Who do you think has had the biggest impact on you for the course of your life?
Almost certainly my parents, I think. Probably if I had to really pick one, I'd probably get in trouble with my mother, but I would say my father really, I think, focused as we were growing up on integrity. And you take it for granted as a kid, right? But particularly as you get into business, sometimes it's frustrating because it would be a lot easier sometimes to cut a corner or make a certain type of deal. But, I think reputation and being able to look yourself in the mirror and really, really understanding what matters at the end of the day. He used to tell us, don't worry so much about money. It's just units. You can't take it with you. So focus on something where you can have an impact or makes you happy. And that has really guided me, I think, my whole career.
I want to spend a lot of time talking about flow and the science behind it. Leading up to that, have you ever experienced any mental health problems yourself?
Oh, absolutely. And I think that was, part of the appeal of joining the company. In college, I was horrifically depressed my sophomore year. Not only did I get like the sophomore slump, I got like the sophomore gained 50 pounds. It was devastated to be away from home. And beyond that, I think depression really runs in our family as well as addiction. And so I was really trying to solve my own problems. And so, yeah, I think a lot of the suffering, it really resonates with the lived experience.
And how did you solve that for yourself way back then?
This is probably not what most people say, but I sort of toughed it out. I think my parents were like, look, we're going to pull you out of school if you don't get your stuff together. You can take it. And I did not want to, I'm very competitive. I did not want to fall behind. And I think there was also a recognition like, look, are you just going to be depressed your whole life? Or are you going to be a victim? Like, let's figure out what's really at the root of this. And then, exercise. I think I tried SSRIs. I hated them. I was so forgetful, which for me is just like a non-starter. So I was fortunate in a way that I could do that. But for many who are really suffering, that's not a reality of their experience.
Yeah. I think there's very few people in the world now who haven't had mental health periods. For me, it was postnatal depression. So it was very much linked to the birth of my first daughter. The help around it was absolutely horrendous. And it was nearly 20 years ago, but it was awful. And one of the things I talked about today because of you coming on the podcast was, I remember a psychiatric nurse came to my home to do an assessment on me, and she pretty much said, it's your fault. You are still depressed because we can't change your medication because you insist on breastfeeding. So it was like,
yeah,
whoa, back then I was trying, I'm a bit like, I suppose how I imagine that you maybe are. I was fighting to get well all the time. Like, I'm not going to let this beat me. There is a way out. There is an answer. I will find the answer. I don't know what the answer is. So I'm going to try this answer and this answer and this answer and this answer. And when one works, it'll work. And at that point, I was trying so blimmin' hard. And then somebody says, well, you're not really trying hard enough because you're insisting on doing this thing for your baby that's really good for your baby, but actually means that we can't change your medication. And of course they could. They just didn't want to.
Yeah.
And so that, like, my journey through depression was really traumatic in the way that I was fighting so hard to find something. And if I had seen Flow, I would have been in there immediately. And yours was slightly different.
Yeah, absolutely. I had a period of depression where several life factors, including running a business pressure, collided with fatherhood pressure post-divorce. And, it was a whole series, I think, as it is for many people, of life factors all coming together at once to form the perfect storm. And I had antidepressants for a little while, as little as I could get away with. I am all about growth and personal development and things. And so I really strive to find a non-medical route out. But I did need that assistance. And again, I would have absolutely jumped on Flow had it been available.
And it's something that, so I again took antidepressants for a year and was lucky enough that after that year, I was able to not take them anymore. But there are an awful lot of people out there who have this guilt about taking medication as if it's like something really, an affliction. Like you just said, it's like, well, I'm strong enough. We were strong enough to not be on it. And that's not the case. For some people, they just need it. But tell us, so all the audience here now is going, what the hell is this thing they're talking about?
Yeah.
So please tell us about it.
So I will. So Flow is a wearable headset that uses a mild form of electricity that we call TDCS, or transcranial direct current stimulation. And what it does is it targets the area of the brain that's responsible for executive function and depressive symptoms. It's called the left dorsolateral prefrontal cortex. So quite a mouthful, but again, focused on executive function, mood, focus, memory, language, response to stress. And what you see when you look at depressed brains is often lower activity in this region. So effectively what we're trying to do with that mild electrical current is gently nudge the neurons back to action, create increased neuroplasticity, more activity, and then reduce depressive symptoms.
Amazing. Now, I've seen, thanks to the font of all knowledge, things like Netflix and films, where electrical therapy has been used in quite an extreme way on things like bipolar and things like that. And this, you describe it as a mild form. Is it similar? Is the science similar, but it's a much milder form? What's the similarities and differences?
Yeah, so I assume you're referring to ECT, or electric sort of shock therapy. It's exactly what my parents asked. So like, is this like cuckoo's nest,
Yeah.
So the mechanism of action is very similar. And if you look at ECT, particularly more recently, as the science has improved, it actually tends to be fairly effective. Now, the downside is because it's such a massive voltage, it also can have terrible side effects, right? That people experience long after treatment has ended. And so what we say is that sort of our ugly stepmother, or our ugly sister, mechanism of action is similar, but so much more mild, right? This is less electricity than you'd find in, like a 9-volt battery, right? So in many ways, it just feels like a light tingle, but the science and the idea behind it is very similar. Yes.
And I think what part of the problem with those images is that you imagine someone who is not, that it's not their choice, and they're being strapped down and they don't have an understanding of what's happening to them because they're so far on this side of the spectrum that they don't have that knowledge. Whereas flow neuroscience is about taking the choice yourself and sitting in your home and doing it in a really kind of gentle way and making a conscious choice in to do it.
That's right. I don't think, what we try and say is sometimes, we hear from people that depression is something that happens to you. And this is sort of using flow as an action you can take to be more of, take control of what is happening. But yes, you're an active participant. And we sort of think of it, as training your brain. You train muscles, right? The brain is a muscle in many regards. And so it's something that you can do for yourself, just like going to the gym.
So tell me about the setup of the business. So what is your role in the business? There were 2 founding partners, is that right?
Yeah, we have our 2 co-founders, Daniel and Eric. Daniel is a psychiatrist by training, and Eric is, he's our CTO. He's sort of our jack of all trades, engineer by back, computer scientist, engineer, does a lot with AI, large language models, things like that. They started the business about 10 years ago. I joined 4 years ago as the CEO, right about the point of European commercialization, with the goal of really taking flow to the next level in Europe and then eventually, hopefully, the US.
And some trusts in the UK, NHS trusts, have taken it on.
That's right. So we now have actually 55,000 users across Europe. We are in 7 or 8 NHS trusts now, and we work with a variety of populations, everything from postpartum depression to the elderly, comorbid, very, very ill, so community mental health, people in and out of hospitals who've been waiting for inpatient care or outpatient care. So really it runs the gamut.
And presumably it is quite safe to take, so like with me breastfeeding at the time, that wouldn't have been an issue.
No, none at all. And I think, of course, when we obviously worked with postpartum mothers, there was a lot of significant safety review. And I think the team has been so pleased with the results. We're now looking at a maternal study for pregnant women. But yes, it's incredibly safe. And while we've been around for 10 years, the technology actually dates all the way back to the 70s. It was actually, I think, first used by the government to try and create super snipers. I don't know how much success they had, but yeah, so we've come a long way. And there's something like 1,000 studies on TDCS, the technology.
Amazing.
What would be the dream for it?
I think one is, can we demonstrate a meaningful alternative to drugs as a frontline treatment, right? I think we're so indoctrinated with pharmaceuticals, and I'll caveat that by saying that for many they are absolutely life-changing and extraordinary, but for many others they simply don't work. And at the point at which they don't work for you or you don't want to take them, you generally hit a wall. I think the dream is if we could put a headset in every home, kind of like an electric toothbrush. Not that I wish depression on everyone, but I think as we look at our roadmap, our goal, yes, is to first help people get from sickness to health, but then health to maintenance, and sort of improving on that as a preventative measure. And I think there's very good science around that. So I think that would be the dream.
What kind of results are you seeing now with the users you've got?
Yeah, so it's 87%, I think, was the most recent number of users will see a result in about 3 weeks, often sooner. It depends on, how quickly they do their sessions. In our clinical trials, we saw anywhere from 50 to almost 70% remission in 10 weeks from depressive symptoms. And, these are moderate to severe depression, so very ill. And we also see extremely good results for people who are not depressed, largely from users who continued to use the device after they were in remission, improvements in sleep, focus, memory, and general well-being.
Yeah, that's fascinating, because as you started that, my brain was going, you need to ask now, can non-depressed people use this? Because it's still sounding pretty incredible. So,
well, I wrote down, to remind myself, I wrote down ADHD. So, our whole family, all our kids, we're all ADHD. we struggle with remembering stuff, and I think this would be perfect for my daughter who forgets medication and things like that. And have you done any specific studies on neurodivergent people with ADHD?
We actually, ADHD, it's technically off label, but it's the largest population that we have in the 55,000. Maybe not surprising, because some of the drugs in particular are so extreme, particularly for minors. And by minors, I mean sort of 15 and above, but also below. And we've seen huge improvements in focus. In fact, our chief sort of psychiatrist officer, Dr. Hannah Nearney, her clinical practice is focused almost solely on ADHD, neurodivergence. And so it's definitely one of the areas we're focused on.
I've got a cousin who can't take any of the ADHD medication, and she really, 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 really struggles. And this just seems like something she could pick up and it would really help. So
yeah. Like I said, executive function, focus, responses to stress. There's some, pretty good studies around like auditory processing, plasticity. And I think, unfortunately, I think part of the modern condition is sort of these dopamine hits all day, whether it's like TikTok or Instagram. And so I don't think it will be long before many of us have ADHD. I can certainly feel that, whether it's diagnosed or not. So yeah.
Mm-hmm. Yeah, absolutely. So you're no stranger to disrupting industries, as we've already talked about. You are definitely disrupting a big one here, and one that has billions of dollars riding on other people, so drugs companies, etc. What sort of pushback and challenges are you experiencing?
Oh, it's been brutal. I don't know if we're on the drug companies' radars yet. We probably are now post FDA approval. But I would say, when I started, and I know a lot of people said this, I personally dramatically underestimated the regulators. They made our lives very, very, very difficult. Particularly as a tiny company. We were held to the same standards as these multi-billion-dollar conglomerates. Now, you can appreciate why, right? Like depression is very, very vulnerable audience. And I think from the gate, we made a commitment to do it the right way. I think, there are some other companies out there, not necessarily, direct competitors, but in the same general space, over the counter, no science, sell it like QVC or Home Shopping Network. And we really felt like the technology was too powerful. We're going to do it the right way. We're going to do it in the highly regulated way. We're going to try and get them on board. But the pharmaceutical companies have had decades to build. They've done a very good job of, training people to expect drugs, to trust drugs, and reject anything else. So it's definitely a battle that is just beginning.
How would you explain to somebody listening how they can use this, what they can do, I know I've looked, but they're going, how do I get hold of this?
So in Europe, you can actually buy us direct. So you can go to flowneuroscience.com. We are available also on Boots for what that's worth. We partner with, I think it's something like 600, 700 clinicians now who prescribe it privately. And then there are some select NHS trusts, which are listed on our website where you can find it. We're not in enough of them. And we are working very hard to try and become more available and accessible in the NHS. I don't have to tell you that is a long battle. And then in the US, it takes a while. Again, there's always reasons. I think we've had incredible support from our early trusts, but it's a slog. And then we hope to be available in the US July 1st.
So, cool.
Yeah.
Amazing.
How do you think that's going to differ to the European market?
Do you know, I've actually been very surprised by the European market because I think, in many ways, one, we started here because we could, right? I don't think there was some grand plan. It was an available market to us. It's sort of where we grew up. It was home. But I think there was a sense, that there's more of an entitlement, i.e. people aren't used to paying for healthcare, right? It's free at the point of care. Like, unlike the US where you'll buy it, snake oil, right? Like there's cosmetic surgery, cosmetic devices, spend on wellness is way outpaces Europe and the US, right? But I think what we found is obviously there's 55,000 people who are not well served by traditional healthcare, and they are willing to pay for it. And so we've learned a ton. What we've already seen, however, in the US is extraordinary demand from clinicians and patients. But I think the clinicians are the most interesting. And when I started, I really thought we'd have a lot more pushback from primary care clinicians. And the reality is, like, yes, of course, there's always your skeptics, but in general, they see every day in practice, like, the limitations of available treatments, right? They have patients that are, they're begging for help and they're just as frustrated. They're like, I don't have anything I can give them. I think they were very reasonable. Show me the science, show me the data, show me the patients, and prove to me it's not going to make my life a lot harder, right? I only have 7 minutes with a patient an appointment. How does this fit in? What I think we see in the US, though, is, again, I don't know how much of this is administratively driven or macro driven, an increasing skepticism of pharmaceuticals. Americans have traditionally been like, better living through chemistry, give me every drug you can. I think you're seeing more skepticism of that based on lived experience, and a demand for an alternative, which wasn't the reality even 4 years ago, even 2 years ago. So there's definitely some tailwinds.
So you can go to your NHS trust if they have it, but if not, you can go online. You can order this headset.
Yeah.
It comes with some pads, I think, that you need to use.
Comes with everything you need for the first 10 weeks. So it comes with the headset, pads. The app will walk you through the entire process, how to put it on, how to use it, track your progress, track your results. And if you do work with a clinician, you can share those results with your clinician. And they can monitor results, they can customize treatments, things like that.
So you can pretty much sit there, watch the TV, have it sat on your head. It does its thing.
Does its thing.
What would you recommend? Is it every day? Is it?
So the protocol is for the first 3 weeks, we recommend 5 times a week. And again, those first 3 weeks, about 87% of people will see results. And then you step down to anywhere from 2 to 3 sessions a week. Some people that have such good results, they want to stay on 5 with clinician oversight. We allow that. But yeah, you can watch TV, you can cook dinner, you can help your kids with their homework. The only thing we say is, probably don't take a bath with it on. But other than that, it's sort of your
very good point.
Yes, and to be honest, you would probably be okay. It's not like a hairdryer, but we don't recommend it.
Absolutely. We did a whole piece of work with the NHS about getting more people into mental health services earlier. And one of the big things that our research threw up was that there was inherently a lack of trust. And I'm sure that that's something that you're facing too, particularly as you're sort of combining mental health services with a new technology to the market. How are you overcoming the trust gaps?
So the way we think about trust is a couple different things. Like, one, we really focused on engaging with clinicians and health systems pretty early on. People trust their doctors, right? We see better results from people who are under clinician supervision. They tend to listen better. So that was one. Two, which proved to be actually less impactful than we thought, was around science and the clinical trial. So we invested a significant amount in a double-blinded, placebo-controlled trial. We really wanted to demonstrate for folks that it worked. I think that resonated probably more with the academics, some clinicians. Far and away, trust comes from the results of other users. So again, I think when people look at our TrustPet results, we have a community on Facebook. It's the other users and their very real experiences that are far and away the biggest trust driver for us. And I think we're so fortunate that so many of our users are willing to be open and transparent and vulnerable with others. They help each other. I think there's no stigma, which is incredible. And that's a really big driver. When it comes to health systems, we try to do outcomes-based pricing, which is like, look, you're not going to pay for it if it doesn't work. To some success, probably not as much. You would think everyone would jump at that, but that is not, it's not as popular as you'd think. So I think the health systems and the insurers is probably going to take the longest amount of time.
Is the Facebook group just for people using it? Is an open group?
It's for people who've purchased the device or are using it. I think you can request to join if you haven't. There are also communities that we aren't a part of that are on Reddit, a variety of social channels. And I think as we grow, those tend to be more active, and you can get, unbiased, blemished and all feedback, as well as our Trustpilot. So I think there's a number of different channels.
Yeah, because I sit here thinking, oh yeah, that person needs it, and that person could do with it, and that person
Yeah,
could do it.
yeah.
But I do think one of the things with the trust piece is it feels like a potential magic wand.
I know.
And I think that's where people go, yeah, but it's never that easy, is it?
I know. It seems too good to be true. And I think what we hear, obviously our early adopters were people who had nothing to lose. They tried everything else. They were desperate. I think, again, as we get better awareness, we move up. And now we have people who aren't depressed at all that use the device. We've tried to tackle that in a lot of ways. Again, telling user stories. We have a 90-day money-back guarantee. You will not pay a penny if it doesn't work for you. I think people sometimes think that's too good to be true, but it's very real. We hope that it does, but if it doesn't, you can send it back. If you don't like it, send it back at no cost to you. And then again, we're hopeful on word of mouth. But yeah, it is tough. And then once we have that trust, we really do our best to keep it. We're available 24/7. You can talk to one of our, 2 support agents, Joanne and Tapas. Like, we really do. They're not AI. I think people are surprised because they're available all the time, but we really do try and take care of folks who trust us. So.
Do you use it?
I do. Yeah. I use it probably not regularly anymore, but a number of the members of our leadership team use it every day for focus to start their day. Whether that's in the morning, some people use it at night. I know a couple of people that use it, to help sleep. So they take it at night. There is a degree of individuality in how people respond and how. So.
Amazing. And how is leading this company different to your time at the Ubers and the Googles?
Well, I would say, I felt like we couldn't really call Google a startup. But, Uber in many ways was very much a startup when I joined. And then Babylon was a startup, even earlier stage. But this was really the first true startup. And this one has been excruciating. Like, there were many, many times where we were fighting for survival. I think Uber and Babylon had the benefit of lots of money. And again, there's a lot of skepticism of devices, starting 4 years ago. I think that's starting to change, but it's not, in a world of AI, we're not always the sexiest things for investors. And, we took some bets on the trial, on FDA, and, there's a huge amount of responsibility because we know it works. And so really just struggling to survive so we can make sure that we can get it to as many people as possible. Yeah, like this was, I think, what does Elon Musk say? It's like standing on a cliff, staring into the abyss and eating glass. Like sometimes that's what it's like. Yeah.
It's really great for our listeners, because a lot of them are business owners, to hear that, because I think people go into business so much, and we talk about this a lot, where they see on Facebook and TikTok and Instagram all these, in my first year of business, and it's just, that's not the picture, is it? For most successful businesses, that are often stood on the cliff top, staring into the abyss, going, oh crap.
No, I mean, like last year when we were battling the FDA and it really wasn't clear, it was a brutal experience. And then there were the layoffs and, we were running out of cash. And I was just going around reading all of these stories of, near failures, whether it was, Elon Musk, a week left of cash, or Amazon, or, even NVIDIA. I think we see these quote unquote overnight successes that have taken a decade to get where they are. You just don't see it. And, I think maybe people don't talk about it enough, but it was brutal. And, when people say, oh, I want to join a startup, my first question is like, are you sure? Like, do you know what this means? Like, chances are it will fail. Now, hopefully not now. I think maybe we've crossed, one threshold, but nothing is certain except death and taxes. So we shall see.
What keeps you going in those times?
The impact, the stories. I think, I probably shouldn't say this, but, when we were really battling with the FDA, there was a point at which I said, I don't care if they don't approve it. Like, we'll find a way to put it on the market. Like, it's too important, right? And I think, again, it comes back to sort of what my father used to say is like, can you look yourself in the mirror? And it's something that I could defend. Now, whether or not it would have been good, we didn't have to do it. But, there are so many people that are so desperate for a solution, and it just doesn't exist. It feels like something was wrong, in the system if we couldn't get it to the people who needed it. And we were trying to do everything right, and if you follow the rules and you can't do it, well, sometimes you have to break the rules, that's disruption.
When did you get when did the approval come?
In December, and it was 2 years. It was a 2-year battle, but a 5-year process.
Wow.
So if we'd had this if we'd recorded this when we first planned to record it, how would it have been a different conversation?
God, I probably would have been much more pessimistic. I think there was a time, what was it, last May, where we were on our third rejection. I think even our investors were like, let it go, focus on your second device, you're not going to get it. And I was like, I've never let anything go in my life. So that's probably a weakness. But at that point, I was like, I have to believe that if you do the right thing, if you have the evidence, you have the results, I have to believe in a world where that matters, because the alternative is just unacceptable to me. And yes, we got there in the end. And what I will say is we were stuck in, as is often the case, this middle management bureaucracy. And we finally spent our last dollars on hiring this very high-powered Washington firm. But what that allowed us to do is engage with leadership. And what I will say was at that leadership level, it was a meaningful difference in the quality of discourse. And so I don't want to paint regulators with a broad brush, but I definitely would have a year ago. I definitely would have been much more negative a year ago.
So the US launch is coming.
Yes. Summer, yeah. Hopefully.
What are you most excited about?
Oh God, just the opportunity to get it out there and to start changing lives. It's been so frustrating as an American, and I used to say, the EU has such a bad reputation as being this overly regulated behemoth, but they're putting the Americans to shame. And I think really demonstrating the power of what we can do. In many ways, the US is also much more challenging in terms of insurance. There is no single payer. The entrenched interests of pharma are actually much more powerful there than in Europe. But I think we already have so many people that are so hungry for the device. It's nice. We certainly don't take it for granted.
And what's keeping you up at night with the US launch?
Everything,
Yeah.
From distribution to pharmacy partners to clinicians. The US is a massive market. It's also very large, right? 50 states in many ways, the 50 countries. So there is an intense amount of complexity. A lot of it, as with all healthcare, does not need to be there. But, I think sometimes there's people whose job is just to figure out how to make something as complicated as possible. And that really comes down to reimbursement, because again, our goal has always been access and affordability. We could have charged a lot more for the device. I understand why people do after they go through this process, but our goal is actually to drive prices down. Can we make this so people don't have to choose between this and something else? We don't really feel like there should be trade-offs in that way. And in today's world, unfortunately, that usually only comes with insurance coverage. And so that's largely what keeps me up at night.
Are you starting in one area?
We're going to look to we're going to start with a relatively controlled launch. We're going to look to get some nationwide coverage, but we have some centers of excellence in some of the larger states like Florida, obviously California, where we have a large number of prescribing clinicians. But our goal is really nationwide coverage as quickly as possible.
What does your day-to-day look like as a CEO of a business like this?
That's a good question. It sort of depends on the crisis of the moment. Right now, actually, it's fairly structured. And now that I've said that, I've probably jinxed it. We're looking at a couple things like performance of the European market. We do some reviews. How's it going? What's changing on the regulatory side, on the commercial side, new partnerships. And then the US, it's really everything for launch. And we're still quite a small team. There's only 25 of us. And so, what if we only raised 20 million to date, going up against drugs that their typical launches are $40 million. So there's a lot to do. So it's really US launch planning largely now. And if there's issues or trade-offs or prioritization, then those pop up.
Something, a process I like to go through with leadership teams when we're working with them is to get a real zoom out and to go sort of 10 years in the future and almost write an obituary of that 10 years. What do you hope people are saying about you and the business and the impact of Flow in the next 5 to 10 years?
My hope is that I don't know. Does anyone really talk about like the founder of Sonicare? I hope that we're at a place where people just take the technology for granted. And in a way, we've worked hard. I think competition is inevitable, but in a way, I think it would be great if people didn't even think about the time where, non-invasive stimulation didn't exist, if that makes sense. So I don't necessarily care if they remember who I am, but I hope they have a device in their home. I certainly hope it's a Flow device, but if it's not, I'll see that as success in and of itself.
Mm. Yeah, I love what you said about the electric toothbrush earlier. I think that's an amazing goal.
Yeah, hope we can get there.
Yeah.
We talk to a lot of really powerful female leaders like yourself, and it would be a bit remiss of us to not ask what challenges you have come across being a female leader, if any.
That is a good question. In some ways, I think I was very fortunate to grow up and spend most of my career in the Valley. Now, that's not to say that Silicon Valley isn't or doesn't have the capability of being, sexist, whatever. But as I mentioned earlier, Google in particular, when I was there, tons of females in leadership roles. We didn't really talk about, there wasn't like this idea of girl boss. It was just like the most capable people. And so what I would say is both Google and Uber were very high performance culture. And so what mattered at the end of the day was really what you delivered. And so I never felt like I was in a worse position because I was a woman. I had some incredibly supportive bosses, all male. Like in general, like I was always surrounded by men, right? But I never saw it as a problem. If I had to really like look back and evaluate, I think I probably got more feedback on my tone or I can be quite aggressive. I can be quite abrasive. And that's even true at Uber, which was a very aggressive culture. I don't think men probably got that feedback, but it certainly didn't stop me. I would say it's maybe a little bit different as a woman, non-founder now today. I think people are perhaps more skeptical when they first talk to me, right? I'm not a scientist. I wasn't one of the co-founders. And so I've seen, I think, more of a challenge more recently, but that's okay. I like a challenge.
Yeah. And I would think we've had that answer from most of our female leaders, isn't it? That actually, yes, it was there, didn't really impact them. They just got on. It's how I've always felt like that. Whenever I've worked in corporates, I worked in ship management from the age of 18 until my 30s. Very male oriented.
I would think so. Yes.
Very male. And I never had any issues at all in that way. It was like you just said, if I really had to pick on a thing, but I would really have to think about it to pick on a thing. I never had that experience, so that it's good for us to compile that and see actually there's sometimes it's just about how you respond yourself as the woman, and how you take that on and how you move forward with it is actually the thing that makes the difference, not the thing happening to you.
Yeah. And again, I think in high performance cultures, I hope it's less of an issue. And again, I can only speak from my own experience. I don't doubt the experience of others, but I was also, I think, tremendously fortunate to have some very supportive male managers, probably by statistics, but who were very understanding. Because I was probably a bit of a nightmare in my earlier years. So I probably deserved some of that feedback, if I'm being honest.
When you say a bit of a nightmare, what does that mean?
Oh, I was, what is it? I'm too old to know everything, but when I was younger, I was just very ambitious. I was, relentless, ruthless. For me, success there were very clear milestones that I needed to hit in order to perceive myself as surrounded by other high achievers. Really, really competitive. And I think you don't have the benefit of any perspective when you're 22. Maybe you shouldn't. But as I've gotten older and become a manager, I sort of say like, that's my karma sometimes, like for how difficult I was and how demanding. And, you don't always see all the other moving pieces. You only see how you're affected and you don't really care about anyone else. And so, I think they had their hands full, but I appreciate that they put up with me.
It was all that swimming you did.
Yeah, that's right.
We've talked to lots of founders and leaderships in smaller, I would say, mission-driven, social-driven organizations who often, in my experience, struggle with the balance between the impact they're trying to make and the commercial performance that they absolutely have to make.
Yeah.
What would be your one thing that you would say to them?
So I would say that we've been fortunate to date that we haven't had to make those trade-offs. And I think there's a way to do well and to do good. I think some of it comes down to how you define what is important to you when you start. Again, like we were very clear from the gate, we always wanted to be an accessible and affordable solution. We wanted to be frontline. We wanted to be available for as many people as needed it. Cost shouldn't be an issue. We've been very clear about our desire to move more into sort of nonprofits, like, as we can. Again, we're very small, but to give back. And I think if that's true from the gate, you set those expectations with your investors, because that's often where that pressure comes from, whether it's shareholders, investors. You onboard or you get support from people who are aligned with that vision. I think too, as much as possible. And again, the more successful you are, the higher the expectations increase, timelines, right? And I think, everyone wants you to be successful sooner and they want you to make more money sooner and they're willing for you to cut corners. But, I think trying to line up front, and in some ways, healthcare is kind of a protected space, right? Because there's so many regulations and there's not as much this idea of like, just move fast, break things. It doesn't matter because people's lives are in the balance. And so I think you have some protection from that. Whereas at Uber and Google, that was certainly not the case, right? It was growth at any and all costs.
Yeah. And it really actually is affordable. You can do a monthly plan or you can buy it outright. And I've looked into this a lot.
No, we try. And look, we appreciate, particularly in today's economy, that it's still not as accessible for everyone, right? So again, that's why we're really focused on our partnerships with the NHS. We want everyone to be able to get it in a way that's affordable. And we are working always to bring costs down. But yeah, you can rent it. You can buy it outright. If you look at the cost per use or the cost over time, it often works out, certainly less expensive than therapy for long-term use, often many second-line drugs. And so again, it's not something that we take for granted. We continue to work on it, but I think most people are surprised over time how affordable it can be.
And it's a lot less expensive, not financially, but emotionally, than being able to, like, having to stay in bed all day because you can't get up, or having to stop parts of your life because you can't function in them. So if you take away the financial aspect of it, the emotional aspect of it, if it solves that problem for you, it's worth everything.
And that, we do hear from users, once it works, I would have paid 100 times. I would have paid anything for this. Once I saw that it works, we had someone the other day that said, I never thought I would say this, but I was so thrilled to be able to go mow the lawn, right? I was excited to go mow the lawn, right? I was excited to get back to like mundane average life, but that was something that was taken from me, to say nothing of like spending time with my children or, going out into society, having dinner with friends. And so, yeah, I think everyone is going to evaluate what that's worth to them differently.
Yeah. For me, the first thing the main thing I remember that said, oh, you are getting better or well, was being able to read a whole book. It was because I was always a reader. And when I was depressed, I couldn't read a magazine article, let alone a book. So as soon as I finished that first book, I was like, oh, I read a book.
Do you remember what it was?
No, it was some
okay. So it wasn't
It was just the moment I finished a book. We know you are very busy, so we will wrap it up. Although I could talk to you literally all day.
That's very kind. It's very kind.
But Matt does have some very important questions. I hope you saw them.
So my favorite questions of the podcast is my last few. But before I do that, I'm just going to make a prediction. I think once this really hits the mainstream part of the market, I think the ice bath market is crippled.
Yeah, I ain't doing the ice bath.
I don't do those either. I can't. No. Like, geez.
No, absolutely. But the real questions I wanted to ask you with, could you give our watchers and listeners a book, a piece of music, and a tool or framework that's really changed your journey that you'd like to share?
One of each or just one total?
One of each, please.
One of each. Okay. So the tool or framework, I think probably more of a framework, it actually happens to also be a book, it is a book called Grit by Angela Duckworth.
Oh yeah, I've listened. Yeah. Listened to that.
And I think I've lived my life with that, but it really resonated. And what I like about it is effectively it's about, achievement is really more about passion and effort than like this innate sense of talent or IQ. And we tend to in society like hold up these people who are seen as like savants or incredibly gifted, and of course they exist, but the reality is, some of the most extraordinary things in the world are done by people who are very average. Like I would tell you, I myself am very average. And the other wonderful thing about grit is that it is something that you can learn and you can train. And so in that regard, the framework is about, honing practice and purpose and interest and how do you build grit in yourself and your families and why that resilience is important. So that's the framework I would point to. Book is maybe a little bit boring, but it's one I go back to a lot. It's called John Adams by David McCullough. I read it a lot. I love historical biographies, whether it's David McCullough writes some great ones, Doris Kearns Goodwin. Because again, in many cases, these are just really average. They're average folks that were doing things at the time that we see now as extraordinary, but they were, really fighting for survival and very principled. And I think the sacrifices that they made at the time so that we could have, hopefully a better country and a democracy, but also their interactions with each other, sort of the dynamics between arch rivals, but the mutual respect. And I think it's sad because I think we've lost a lot of that in today's society. I think it's really toxic, not just in politics, but general. And my hope is that we can sort of get back to that. I hope we haven't lost that. A piece of music. My playlists are so boring. I'm one of those people that listen to the same song over and over, but I'm if you looked at my phone right now, you'd see the Fleetwood Mac, the dance, you'd see I listen to that 100 times a day. Maybe if it's focus time, I'll listen to some Enya. Like I've just embarrassed myself, but those are the two. There's no shame in it. There's no shame, but those are the two I would point to.
Absolutely amazing, and there'll be links to all of those in the show notes, guys. So go and get those. There'll also be, of course, links to Flow, and how you can get hold of that. Particularly in the UK and Europe, and we'll update it once the US launch is out there.
Wonderful.
So I'm going to go and listen to John. I love autobiography, so yeah. That's a great thing. But are you a Hamilton fan?
The musical? Yes,
yeah.
Yes. I have seen it, yes.
We love it.
Do yeah. No, I actually saw it in London, believe it or not. So yeah, that's an interesting memory, but yeah.
We saw it in London and Birmingham. But it's a great way to get into that history and learn about stuff that I'd never, like if you'd said John Adams 5 years ago, I'd been like, who?
No, well, and I appreciate like it's a very American focus, like as we are wont to do, but I think there's some good overlap, perhaps. And yeah, the same thing is true of Hamilton. Like Alexander Hamilton, who the hell is that? So maybe we should do musicals for all of our historical figures.
Absolutely, yeah. Absolutely.
Yeah. Well, they're trying, I think.
Yeah. Good.
Trying to squeeze them all in.
Could do worse.
Yeah, absolutely. Well, Erin, thank you so much for joining us today and sharing your story and insights, and really, thank you for sharing this technology with the world as well.
We are rooting for you.
Oh, thank you very much. We'll take all the support we can get.